the memories that I have of that are kind of like an out-of-body experience.
There are 3 words no one wants to hear. You have cancer. But new data is revealing that message is unfortunately being shared at higher rates with young people. WCTV Investigates is shining a light on these studies showing the disease is becoming more common in young adults.
Our investigative reporter Zach Dahlheimer joins us to break this all down after he and photojournalist Sam Thomas talked with a local doctor and a Tallahassee woman who beat cancer at a young age. So Zach, how often is cancer showing up in younger people?
These are stats we got from the American Cancer Society. The group says about 80,000 between the ages of 20 and 39 are diagnosed with cancer in this country every year. About 9,000 die every year from the disease. Now, researchers also found cancer is the 5th leading cause of death in this age group and the leading cause of death from disease among women in this age group. And this is just scratching the surface. A local breast cancer survivor and TMH oncologist are getting in front of data like this to make sure young adults are aware about a concerning, mysterious new trend.
Thank you. This was a very fun age.
For Brittany Auclair and her 12-year-old son, Braden,
This is actually the first time that Braden was ever trying ice cream.
these photos and videos mark moments in time. Brittany helping start Braden's life, while Braden
I'd like to call him my little superhero.
helping save hers. Braden was just 8 months old when Brittany first noticed something while breastfeeding.
He decided that he favored one side over the other. But I did notice that while I went to work and I was pumping, that there was a lump.
She followed up with her doctor, who's also a breast cancer survivor.
She said, I'm not waiting to make an appointment. I want you to come in as soon as possible.
Thinking it was a clogged milk duct, Brittany underwent scans and tests. And then, just a few days after her 29th birthday, she got the news.
I remember kind of hitting a brick wall, hearing her say, you have cancer, and how we're going to move forward. And then I shut down.
Brittany, a young wife and new mom, was now battling triple-negative breast cancer. Questions about her future and why then were now top of mind.
Am I going to die? I'm breastfeeding my baby, and now I have breast cancer. Are they going to take that away from me? Am I going to be able to have more children? At one point, if I heard one more time, you're so young to have cancer, I thought I was going to scream.
As she went through months of treatment, surgery, and chemo, daily tasks became taxing.
Doing normal activities, going to the grocery store, going to make dinner or plan meals became super stressful.
But with support from family, friends, and coworkers, Brittany completed treatment in October 2013. Now, 12 years later and cancer-free, she's learning what she thought was uncommon for her age is becoming more common.
When I went through my story, I felt like I was the only one. I've now read several stories where there are young mothers that are finding their cancer.
It's definitely an emotional situation.
Dr. Amit Jain is an oncologist at TMH who's seen patients across the Panhandle in South Georgia for more than a decade. He specializes in colorectal and lung cancer treatment. Lately, he's noticed a disturbing trend.
I have definitely seen men and women as young as 29, 30 with colorectal cancer, with no family history, no predisposition, no risk factors, and how they present, you're never thinking cancer.
A new study by the American Cancer Society shows young adults identified as Gen Xers and millennials may be at a higher risk for getting diagnosed with cancer. Researchers found that 17 of 34 types of cancer are on the rise in these two groups when compared to older generations. These include breast, pancreatic, and kidney cancer. Other data from the group shows cervical cancer cases rose by 1 to 2% each year in 30 to 44-year-olds from 2015 to 2019. And for colorectal cancer cases, the same spike as well in that time frame for people younger than 55. What's your reaction to the new data that's coming out?
Just absolutely shocking.
Dr. Jain says he and TMH colleagues are seeing a rise in breast and colorectal cancer as well as melanoma in younger adults.
These are folks who do not have a smoking history, they don't have any family history, they are healthy lifestyle and doing everything the right way.
And the big question is why?
That is $1 million question.
Brittany asks herself a similar question today.
We don't know where my cancer came from specifically, if it's something attributed to society, the foods that we eat, or our cell phones. I I'm not sure where it's coming from, but I do see that increase.
Dr. Jane said studies are ongoing, but he believes more research and awareness needs to be done in this age group.
Never ignore any symptom.
Brittany agrees and thinks experts should consider lowering age guidelines to help with early detection and prevention.
They need to be aware. I don't think it's something that they need to stress about every day, but I think young people need to understand that it is occurring.
Okay, so when it comes to curbing your overall cancer risk, especially if you are a young adult, here are recommendations from the American Cancer Society. Do not smoke or use tobacco and limit alcohol intake. Also, eat well, stay physically active, and maintain a healthy weight. They also recommend using sun protection and getting the HPV vaccine. Now, Julie Jacob, you can read what American Cancer Society researchers have to say and look at cancer data in Florida and Georgia right now on WCTV.tv.
All right, Zach, as you said, disturbing trend, but one that we can all do our part to try to help curb. Thank you so much.